This is a Jet 24, Fox 66, your Erie.com special report.
Good afternoon. We interrupt our programming to bring you a special report, an update on the spread of COVID-19 in Erie County. We will head to the studios of WQLN, where Erie County Executive Kathy Dahlkemper is ready for her daily briefing.
Good afternoon, and thank you for joining me in my daily briefing on the COVID-19 pandemic here in Erie County. Today we have 2 new positive cases of COVID-19 in Erie County to report. One of them is in their 40s, and one is under the age of 5. This has us at a total of 84 cumulative positives, 1,770 negatives. The Erie County Department of Health, as always, continues to do the contact tracing and to communicate with the state. The 2 new cases are located in Zone 1 and Zone 4, which can be found on the cumulative cases map by zone at eriecountypa.gov. We have 56 recovered cases to date. Crawford County is at 19 positives, McKean at 5, and Warren at 1. Chautauqua County has 31 cases with 3 deaths, and Ashtabula has 110 cases and 11 deaths. Again, the best practice is to act as if everyone that you come in contact with has the virus. So please continue to take the precautions when you leave home that we've been discussing here daily. Wearing your mask, proper hand washing, and maintaining the physical distancing of 6 feet. We understand how challenging this behavioral change can be for each and every one of us. But these are the only tools that we have until a vaccine is discovered and treatment is found. On Saturday, Karen Tobin, who is leading the business education and compliance in this pandemic crisis, reported a 95.5% compliance rate of masks being worn at businesses across the 5 zones of Erie County. The lowest rate was 84.3% in Zone 1, the city of Erie. Well, yesterday, the inspectors at the Erie County Department of Health did another surveillance across the county and found we had slipped a bit to just a 91% compliance. All areas except Zone 5 had slipped a bit in observance of people wearing masks going in and out of businesses. Unfortunately, the compliance rate in Zone 1 dropped 22% to just 62.3%. That's in the zone where we have the highest number of cases in Erie County. We are working hard to support the residents living in Zone 1 so they can be safer by providing masks, providing information in various languages, providing more education via very different platforms about the behavioral changes that need to happen to mitigate the spread of COVID-19 throughout all of Erie County, and most particular in Zone 1. To tell us more about masks and so much more, I'm very happy again to have with me Director of the Erie County Department of Public Health, Melissa Lyon. Melissa?
Thanks, County Executive. I'm really here today because I want to talk to you about the fundamental public health practices that we have, and they're not many. So as we approach the reopening of Erie County, I really want to encourage everyone to follow the guidance that's being issued. The Erie County Department of Health has been working tirelessly and very quickly to create guidance as it becomes available for our businesses and organizations to make sure that we're making good decisions and keeping everyone safe in our community while we're still able to operate. And at this time, we only have a few fundamental public health tools available to us to contain the spread of disease. That's what we're doing right now. We're trying to contain the spread of disease. These tools you've heard many times. They've been repeated daily by the county executive and Secretary Rachel Levine. And it's good personal hygiene. Washing your hands frequently, 20 seconds thoroughly, is so very important. Social distancing, keeping a minimum of 6-foot distance from anyone who does not live in your home. And universal masking. Your mask protects me and my mask protects you. Wear your mask when you're in a drive-through and you want to pick up your food from the cashier. You really are closer than 6 feet in that situation. When you're inside a store, you will be passing people. You will be closer than 6 foot when you are in that store. You need to be wearing your mask. When you're at work, you will run into situations where you're close with other employees. You need to be wearing your mask. And anywhere where you're near other people. I'd like to ask that you continue to limit your traveling. Don't travel unless you absolutely must do so. Identifying COVID-19 positive cases and requiring isolation and quarantining their contacts, that's what we're doing every day. We have a team working on this 7 days a week. They make phone calls to the positives, they identify their contacts, they reach out to those contacts and instruct them that they've been a contact of a known positive, and we ask them to quarantine for 14 days. This work is very intensive, and it's about building relationships so that people want to comply with isolation and quarantine to prevent the spread of disease. And the things that I've just gone over with you, this is all that we have right now until we have a vaccine or till we have treatments that have been developed. So we need to be doing these things. I know that it's difficult. It's a significant behavioral change, and it requires all of us to make these changes. I know it isn't easy. It's even difficult for myself. But as individuals and the community, we must model this behavior. The cultural practices of handshaking, hugging, and greeting one another with contact is unfortunately a thing of the past, or at least for the foreseeable future. We must begin to understand that even our family members, those who do not live with us or who do not live within our homes, can become ill and spread the disease as well. We must accept that no large gatherings are going to be scheduled for the near future. Our shopping habits have to change. We no longer have the luxury of browsing the store to find the perfect product. In order to make these changes and implement these fundamental public health practices, we must all do this every day consistently. It's like fastening the seatbelt when you get in your car, or when you go for a bike ride, wearing your helmet, looking both directions before you cross the street, coughing into your elbow. These are all behavior changes that keep us safe and healthy in our day-to-day movement, and we just need to add a few more things to that list. I know you can't see all the work that's being done, but I'm asking that you trust the public health experts and follow our recommendations. We are making educated and informed decisions in partnership with the Pennsylvania Department of Health. Our number one priority is, and always has been, keeping you healthy, protected, and safe. We help prevent disease, we promote healthy behavior, and we protect our environments. Thank you.
Thank you, Melissa, and thank you all for continuing to be the partners in this effort that we've asked you to be. And we ask you to continue to share all of this vital information with others, those who do not tune in to these briefings, those who maybe have limited access to other media forms. So please continue to be partners with us in this. And I'd also want to acknowledge everyone who participates in really these small acts of kindness. These are happening all over our community, and your generosity is being seen in small ways and large ways. One such example that was brought to my attention is Elevate Church. They're offering free pancake breakfast every Saturday, 9:30 to noon, through this time of quarantine. They wear masks, as you should too. As we said, when you're driving through any place where you're picking up food, you should have your mask on. All you have to do is to drive up to Elevate Church, roll down your window. They'll deliver one breakfast per person in the car. So please share these kind of great stories with me and with our community. These acts of kindness are helping us all to get through this very, very difficult time. So now I'd like to ask the media for questions, and we'll start today with Talk Erie. Joel, are you with us?
Yes, ma'am. Thank you so much. I just want a little clarification on what you're hearing about the yellow phase. And again, with just 2 more cases, it looks like our numbers are coming in well. How much of these mitigation factors will still be in play under yellow? I'm especially concerned about folks that have not seen grandparents, parents, out-of-town siblings and so on, that now that the stay-at-home order would be lifted, there is build-up demand for travel?
Thank you, Joel. That's a great question. We are still waiting much guidance from the state. There's a couple calls set up for in the next 24 hours or so that we will be getting a lot more information from the state. So the information is coming in, but the state is still, I think, working on some of these guidelines for all of us that will potentially, and it's not a given, but we certainly hope that we are in that number that can begin to open up a bit on the 8th. So as we get that guidance, we're certainly going to be bringing it forward as quickly as we can to all of you. As to your point that so many people are waiting to see the people they love and care for and are looking forward to that moment when they can go do that again. As to Director Lyons' point, the way we greet each other still have to change. So we can see our family members, but we shouldn't hug at this point. We should be in their presence and still keep 6-foot distance and still be wearing a mask because we haven't been living with them. And again, you could be that carrier of COVID-19. I could be that carrier of COVID-19. Your family member could be that carrier of COVID-19. We don't know who that is. And so being in their presence, but still using those social distancing guidelines that we've been given, masking, and then of course washing your hands and cleaning off your surfaces is best. And if the weather's best, it's also best to stay outside because you don't have the surfaces that you do inside of a home, and it's a bit safer there. I don't know if Melissa Lyon wants to add anything to that about the pent-up demand to greet our family and loved ones.
I don't have much to add, Kathy, other than I'd like to reinforce the statement of, I know we all want to get back together and we want to embrace and hug, and it includes myself when I get to see my grandchildren again. But I need to caution people that that is how this disease is spreading from person to person. That real intimate contact can put us at greater risk for spreading the virus. So be incredibly cautious when greeting family members, even as we move into a yellow phase, and also really limit the amount of travel. It's just so important right now. The disease is still circulating. The virus is still circulating in our community.
Just a quick follow-up from Melissa. Is there not any kind of more confidence that you can give a person that I could get my temperature checked, or I could, have no symptoms? I mean, there's got to be a way to know that I am not a spreader.
I really wish I could give you that level of confidence as the public health practitioner, that there was this way that I could say you had a test or you're not symptomatic and therefore you're not able to spread the disease or you're not contagious. And unfortunately, viruses are designed in a way that is most beneficial for the virus. It is not designed to protect you as the human. And you've heard me say that they're sneaky. And so, for example, COVID-19, we believe that people are asymptomatic 2 days prior to developing fever or any symptoms. So you can be 2 days in the community without symptoms, being symptom-free, and potentially spreading the disease, which is why we're saying staying at home and limiting travel is so important. And if you were to receive a test and test negative, that's only a snapshot in time, that at the time that the sample was taken, you are negative. And the time that you walk out of that location or move around the community, you're still putting yourself at risk. So please keep in mind, the virus is designed for the benefit of the virus, and that's finding the next host. And it's done this in a way that is very particular and the asymptomatic. And we're still trying to figure out how many people could be asymptomatic in a community to understand that risk. So probably not the most promising answer you wanted to hear, Joel, but that's the reality.
Yeah, thanks for the explanation.
Jet TV.
Yeah, hi, Kathy. It's Samir. So now that we have 2 cases of an individual under 5 years old, I guess what's your reaction to that?
Well, I think any child, obviously, is a huge concern for all of us. We've often talked about the elderly being at risk, but we also know the youngest among us are also at higher risk. And so, huge concern with that. And, you know, any child who contracts COVID-19 had a connection to someone. You know, they're not out just wandering in the community by themselves. So they've had a connection, and that's what we go back to this whole thing about we don't know exactly that we are the carriers, maybe up for 24, 48 hours before we have symptoms, and then we may have been with someone who we love dearly but is at higher risk, whether that be our grandparent or whether that be our grandchild or, you know, anyone in between. And so it's very, very concerning to have these youngest among us with COVID-19 positives, but we have great health care in this community, and I hope and pray that they will recover completely.
And then I believe the state has 2 more cases. I believe they have 86 listed for Erie County. So do they know about 2 cases we don't, or how is that factoring in? Do you know?
I'm going to have Melissa address that one. Melissa?
Thanks. The numbers that the state reports, we've seen throughout this entire pandemic that we are either sometimes ahead of the state on our reporting or we've lagged behind them on that reporting. When it's been us lagging behind, it usually is about a lab result that's been submitted that is either not on our radar screen or that we have to go back in and make some adjustment in the National Electronic Disease Surveillance System that you've heard about from NEDS. So there is some manipulation from the case investigator in that system that begins to jive the numbers over time. And don't forget, they pull down their numbers at midnight to report at noon, and then we're reporting our numbers based on what are considered case investigations. So there are times where we may see this happen 1 or 2 off, but they do get resolved. Be assured that in the long run, they do get resolved so that our numbers will match.
Erie Times News.
Hi, Kathy. Just a quick clarifying question. The state said earlier today that they're planning to announce specific counties that they want to move into the yellow phase on Friday, this coming Friday. Is that when you expect to hear about us moving on May 8th as well?
That's right. When the state reveals those counties, will know. We are encouraged that we may be one of those, but there is no guarantee yet. Our conversations with the state in the meantime are really trying to clarify what do we need to be ready for if we are one of those counties, and what do our businesses particularly need to be ready for, because they're asking us for a lot of information. And we also think, because we are one of the few counties with a health department, and we've had a very, very strong what we call enforcement or education team who's been working really as a partnership with our businesses all through this time, that we might have some good information to impart upon the state as they're looking to the northwest and the north central as being potentially the 2 areas that would open first. And so that's another reason for the calls with us, because you know, again, we have information that many other counties do not have about how we've been successful here in a larger county and a county with a health department.
So I'm sorry, Kathy, that may have been a poorly phrased question on my part. Do you expect to hear from the state for sure whether we will reopen on May 8th by this Friday?
I hope so. You know, we need time to prepare for this. So, I mean, we are, you know, sometimes we find out things while I'm on the air here, like I did yesterday. So, sure. You know, the communication is what it is. Everybody's trying to do their best. The state's trying to do their best. We're trying to do our best. It's difficult. There's, you know, a lot of moving parts on this, but we are hopeful that we will know when they put out a list. If they put out a list on Friday and we're not on the list, we know we aren't, and if we are, we will know we are. Thank you.
Thank you.
Erie News Now.
Hi, I'd like to follow up on that, if I may. The fact that it would be Friday that we would find out, giving us basically a week until that potential lifting somewhat of restrictions. Are there concerns there? Is that something that's really tough for businesses, only having that week to get ready? I know you've been saying prepare now, but for the time being, they're still somewhat in limbo, and then after 2 weeks of waiting, hearing maybe, then it's just a week to know whether or not they can reopen?
The sooner we can find out and the sooner we have guidelines to give our businesses, the better for them. And I think we all know that to be true. And we've been telling our businesses all along, you know, create a plan, look at the guidelines that are out there for the life-sustaining businesses that are currently open. I would imagine the guidelines will be very similar to those guidelines and just the CDC guidelines that are out there and the Department of Health guidelines. So all of those collectively basically tell the same story for businesses of what they're going to need to do when they are going to open up, whether that be our construction businesses opening up this Friday, other businesses potentially on the 8th, or whether we're delayed till some other time. The best thing to do is to plan ahead. But yeah, we don't have any. We wish we had information, you know, far enough ahead that everyone had plenty of time. But as we know, when the businesses were closed down with the state mandate, we didn't have any time to prepare for that either.
And so what would your advice be to a business owner who right now doesn't know if he or she should be buying inventory or not? And then even if we are allowed to reopen a little bit on the 8th, he or she doesn't know if they'll be included in that. I've just had a handful reach out to me and talk about how frustrating this is, and they asked me to voice those concerns. So, you know, your thoughts on that?
It's frustrating. I agree with them. And all of us are frustrated. And again, this is something no one has ever had to deal with before, not the state, not the locals, not our businesses. The Chamber has been a huge partner, as well as the rest of the partners in the economic development ecosystem, and they have been really trying to work hand in hand with us in getting the right information out to businesses. And so we're going to all work together. This is the time when everyone needs to be as flexible as they can and as patient and as understanding as we can, because in the end of the day, you know, we're trying to keep people safe, we're trying to keep our community healthy, and we're trying to still try to move things forward. And any information I have, I bring to you at 3 o'clock every day. So we're not holding back any information, and we haven't gotten any further guidance from the state than what I bring forward right now or what's on our website currently. Talk Erie?
Yeah, let's talk about the mask, if you would. You mentioned that our ability to, or just the observation of the number of people wearing masks dropped from over the weekend. And you said something about providing masks. How is that being done? Is there a store of masks that is being released to some of these life-sustaining businesses or big box stores? Can you talk about that?
So there has been an effort, actually way before we even started telling people to universally wear masks, and that's a group called Mask Erie was making masks. Serve Erie and Grace Church were also working on how they could provide masks. They've now come together, they're working diligently, and they're also in connection with our team at the health department. And so as more masks come in, we have a group of medical reserve individuals who are laundering those masks, then putting them in bags, and then getting them back to Serve Erie, and those entities who are then getting them out to the areas where we know people may have more difficulty obtaining their own masks and where we really need to see some change in that. So that's just in a nutshell what we're trying to do. I don't know if Melissa wants to add anything further to this since she heads up this whole operation, and that group is under her leadership. Melissa?
Sure. I'm happy to add that as early as today, we were talking about pinpointing and strategizing areas based on the new data that we got back, that there might be some lower compliance rates in maybe the city of Erie and our more populous locations in the county. And I don't have details about what that strategy might look like, but I'm happy to report that we're using data-driven decision making. So when we're collecting that data, we're not ignoring what that data is telling us. And then we'll be discussing with a team that strategizes on how we'll get those out. Door hangers is one of the things we're working on. And so there's a potential for some distribution through a door-to-door campaign. So those are just some of the things that, a little bit of a sneak preview of where we're thinking as public health.
Thanks.
Thank you, Melissa. Jet TV.
Yeah, hi, Kathy. Samir again. I'm going to ask Melissa to answer this question. I believe this would be under her purview. So yesterday I reached out. A viewer sent me a question regarding the stats. So I hope you have a pen and paper. I'm going to list off some numbers for you. So this is obviously following yesterday's numbers. So, of course, we had 82 cases and then 53 recovered, leaving 29 active cases. So their question comes, shouldn't that technically equate to 27 active cases, considering 2 of them are dead?
Yeah, so I'm so glad you asked this question because I got to have a fun conversation with some others that were asking about the numbers. So I'm going to rewind a little bit and tell you how in public health we track disease. And there's 2 main methods, and one would be called incidence. And incidence is the number of new cases typically measured per 100,000 population. So, and it's over a period of time. So how many new cases are you seeing? It's a very important data point for us in public health. Do we have disease contained, or are we seeing increases in incidence, right? And when you begin to see increases, that says, you need to adjust your strategy or do work differently to bring that number back to 0 is your ultimate goal. So that's incidence. And we have what's called prevalence. And prevalence is the total number of cases in a population over a period of time. And then that's a nice way for you to be able to do comparison. It's usually per 100,000. And you can compare across county lines or different areas. So realistically, we have those 2 methods, and then we count deaths. So in influenza, we would have a death count as well. So those are the 3 ways. Now that we're in COVID-19, individuals want to know, have people recovered? And so we've agreed to track that and report recovered numbers. And then by deduction, you can say after they've recovered, what you have is active. So those are new data points per se that we've put together for the community so that they can have a more comprehensive understanding. But it's not the way that we track diseases at all. And I don't anticipate that it will be put into the methodology that we do moving forward. Way of sharing information. To answer your question in a very long and roundabout answer, we would deduct those 2, and that it would have been 27 active because of those 2 deaths. That's correct. And we've made that adjustment for the data that you'll be seeing moving forward. That adjustment will be made. But that's why that happened, is because it's not how we normally track disease in public health. So thanks for that question, and thanks for sticking with me on that long answer.
All right, so just to follow up with that, please correct me if I'm wrong. So up until this point, technically, the dead cases could be considered recovered?
We wouldn't have ever had if someone passes away in influenza season, we don't have them as recovered. We don't track the number of people that recover in influenza. Does that help answer your question?
Right. But for COVID purposes, I guess then? Or is it the same?
We would have just said that they have passed, and we will deduct those numbers. So you'll see that adjustment moving forward. Is that helpful?
Yeah, perfect. Thank you.
You're welcome.
We are all learning so much about disease tracking, epidemiology. I've joked that in my next life I'm going to come back as an epidemiologist, but I really appreciate Melissa's knowledge and her explanation of things. She explains things to me every day, and I'm learning a lot. Erie Times News.
Hi, this might also be a question for Melissa. On a media call earlier today, Governor Wolf said that there's not a specific benchmark he wants counties to meet for testing of COVID-19 before they reopen, but that he sees testing as a really critical component to building public trust. So do you think that we have enough testing in Erie County to build that confidence in the public, and do you have a specific benchmark you're looking for that you'd like to reach for testing? Sorry for the long question.
No, thank you for the question, and it's incredibly good timing to ask the question as we were on a call earlier this morning with the State Department of Health, and testing was, we had 2 topics that we discussed, testing and contact tracing. Again, if you reflect back to my comments, I said we only have a few tools in our toolbox that can contain disease. So identifying new cases, so important, and then isolating those when they're positive, contacting those that are their contacts and asking them to quarantine. Those are the tools. So to answer your question, is there a benchmark for testing? The state has not provided us a number of tests that they're expecting us to be able to accomplish. But we did talk about how can we increase our capacity in the communities that would go into a yellow phase, and then how will we increase our capacity to do contact tracing, isolation, and quarantine. Because as I've mentioned, as we move around in the yellow phase, there's likely going to be more disease circulating, more virus circulating, which then ends up with more positive cases. So we need to build out that capacity. And I am confident that we will see opportunity for more testing, and the trust level will then have to build from that, that those that need to have tests and meet the testing requirement have access to that. So again, I would echo what Governor Wolf has said. There's not a target put out there for us, but we're talking about increasing that capacity. I hope that answers your question.
It does. Thank you so much, Melissa.
Erie News Now.
A question for Director Lyon. As you talk about contact tracing and the need for more tracing, we've seen Massachusetts looking to hire 1,000 extra contact tracers. Your thoughts on that? Do you think it's something that Pennsylvania should do as well, try to hire additional contact tracers? And do you think that that could benefit our area in terms of being able to, A, reopen, and then B, try to keep things that way and try to keep case numbers relatively low?
So I'm so glad that you've been looking at a lot of the same reporting across the country that I have. It makes answering the question a little easier. I was very intrigued when I saw Massachusetts had put together a state plan to hire additional contact tracers. And in order for us to contain disease, as I said, our tools are so limited, it's primarily, it's a necessity. And in Erie County, we've just started some conversations on what that could look like for us as a public health department, meaning is the state going to augment that work for us with personnel? Are we going to have to hire personnel? Are we using community partners? But it is going to be imperative that we have increased capacity of contact tracing. And those are people. It really can't be done any other way. If you remember back when I was talking earlier, building relationships is so important, and our public health nurses are so good at building those relationships because they do the investigation, and that trust is what helps the investigation to be thorough. So people are going to be needed to do contact tracing for sure. I don't know what it looks like yet in detail, but I anticipate that it will be here in Erie. Yeah.
And if I follow up on that, if I may, what sort of skills are necessary for someone to do that? Is that something where someone needs a medical or nursing background, something like that? Or would this be an opportunity to bring back furloughed county workers and have them making calls, doing that sort of thing?
We're exploring all different ways of trying to accomplish this. Ideally, having a medical background or a public health background, a scientific degree, a science is very, very helpful. It just is the way that the contact tracing is done. Do I think it's a necessity? Likely not, if we can get some really good on-the-job training with a certification, which, as I've looked at options in the country, there will be some certification trainings available. So I think we'll be flexible in the skill set we're looking for. Knowing how to handle conversations that can be of a sensitive nature, understanding how to deliver messages to people in a calm way, reassure them that we're there as a partner and a trusted member. Those are skill sets. There's this really important soft skill set that's needed to do it. So I hope that answers your question, but we will be flexible on what we're looking for to accomplish this pretty significant task ahead of us.
Sure, great answer. And one final follow-up on that, if I may. In your opinion, just ballparking, again, not knowing how you're going to get them, whether it'll be state mandated, whether or not you'll be in charge of that, but a ballpark figure of roughly how many extra contact tracers you think would suit Erie County?
Well, I'll give you a little background. Is I put out a number yesterday that was a gross underestimate of what I was going to need if you compare to the NPR report today that said 30 per 100,000 population. So if you can do the math, if that's an appropriate number, we have over 200,000 population in Erie, so we'd need close to 60 plus additional personnel. Do I think we'll get that? And do I think that number is accurate? I'm not sure. It's something we have to take a real look at. If we keep our numbers low and we do the hard work we've been doing and the community continues to universally mask, social distance, and limit travel, we have the potential to do that with less people. If we take for granted the options of moving around and we don't take masking seriously and hygiene and social distancing and we begin to travel, our numbers will increase very significantly, very quickly. And if we become overwhelmed, that's a big concern because we won't be able to contain the spread of disease, which then puts us at jeopardy of remaining in yellow and maybe never getting to green. And then the worst case scenario, having to revert back to red, no one wants to go there. So I think I have a really important message on how everyone in this community has to model this behavior because our public health tools are very limited, and it's so important that we mask and do these difficult behavior changes. If I can ask anything of everyone listening, just to do that.
Thank you, Melissa. Talk Erie, do you have a final question?
Real quick to follow up on the contact tracing, has any consideration been to engaging the universities to help with some of this data collection? And, they have nursing students and so on. Have the universities been contacted at all?
Melissa, do you want to answer that? Since I know you've had more conversations.
Sure. I have not had formal communication with all of our universities here. There have been internal conversations about the level of students that could be utilized for contact tracing. The first report from the state was they were looking for master's degree is what they had said, but I don't know if that was a definitive response. I think there's a lot of flexibility around that. I have also had some informal conversations with a few of the universities, and they're willing to help in as many ways as possible, and it could be as well faculty to assist. And so those are some new developments that have happened really within the last 48 hours.
And quick follow-up about testing. You had mentioned that you want a lot more testing. Has the CDC changed their guidelines? Right now, the testing protocols are so tight. Have they loosened up officially from the national and state level?
I can tell you what we spoke about on our call around testing is the individuals will still have to be symptomatic for testing, and that's because virus has to be present in order for that test to be valuable, and because it's an RNA replicated test that detects virus. If we had it open up to non-symptomatic people, we're not sure that a positive result would be obtained. And that's why the symptom piece of it is still a portion of what makes you eligible for that test. But those symptoms can be fatigue. Those symptoms can be a runny nose or a sore throat. The symptomology, I think, is going to be more flexible, especially as testing becomes more available.
Thank you, Joel. Jet TV, do you have a final question?
Yep. So my question right now is regarding, since we are moving, or seem to at least positively could move into that yellow phase, has the health department reached out to businesses for, I guess, protection plans or what they plan on implementing guideline-wise whenever reopening?
So we have a liaison who has been, first of all, I've had direct conversations with the chamber and with the lead team. I've been on their call a couple times, so we've been reaching out that way. And now we have a liaison from the health department, from our COVID incident command team, and that person has been working directly with personnel at the chamber, and we expect that they'll be very, very helpful with getting the information out to our businesses once we have the information to give them and the guidance. We did that this week with the construction guidance, for example, and we not only reached out to the chamber, but we reached out to the local Builders Association, and we're trying to find all of those different means to reach our businesses because those groups, of course, have all the contacts.
And then just to follow up, I guess, regarding masks, do you guys have an estimate for when we'll be able to get masks out to the community, or have we started that?
Well, as I said, there is already this effort that's been going on with Mask Erie, Serve Erie, and Grace Church and some others, and we are working directly with that group. There's masks, being distributed in a number of ways. Employees have there's a business-to-business website on the Department of Community and Economic Development. That's a state website of DCED, where they have businesses on that website who can make masks, whether they're cloth masks or surgical masks or whatever kind of masks you're looking for. And then those are businesses in Pennsylvania that a business who's looking for masks then can reach out to that business. So I think that's a real great resource that the state has put out. Erie Times News, do you have any last questions?
Yes, very briefly, Kathy. Do you know whether either of the two children under 5 or 5 or under who have coronavirus are hospitalized?
I do not have any indication as to whether they're hospitalized or not.
Thank you.
Erie News Now, do you have a final question?
I do, please, and it's for Director Lyon. I know we talked last week when this news came out that May 8th was kind of that target date, and you said it's one of those things where you kind of wait and see and you watch what happens. Obviously, we're still a good week and a half away from that, but as that date does inch closer, and as you've had a little bit of time to look into this, and of course with that knowledge, you still feel fairly comfortable with that May 8th date, that seems fairly reasonable for Erie County, at least right now, understanding, of course, that things can change within the next handful of days.
Thank you for the question. And from a number of new cases per day, I think my confidence remains the same. It's still manageable, and disease containment is still within our purview to accomplish. As far as the May 8th date, it seemed to be, the date that was selected, and I wouldn't argue that the date is a good or bad date. I think the part that would be, I wish I were sitting here more comfortably saying that we had some guidance for the businesses that will be able to open and what that guidance looks like. And unfortunately, we don't have that level of detail. And for that, I am just disappointed to not be able to share more around that.
Thank you. Well, thank you again to Director Lyon for bringing just such great information forward for the community. I think we all appreciate when she has the ability to come on to this briefing or anytime she's able to speak to the community. She's so knowledgeable. Her entire staff is so knowledgeable and working really endless hours, 7 days a week on this whole thing to keep you safe, to keep our community safe. And I want you to know that everyone in county government, and most particularly at the Department of Health, are really here for you and trying to serve you. I'm going to end with just a couple things about masks. As we did the surveillance yesterday, there was 2 areas where we found masks were probably the biggest concern. One was through the drive-through, and so please have your mask with you in your car, and when you go through that drive-through, for the sake of the person that's actually giving you your food or your drink, wear your mask for them, because remember, your mask protects them, and then hopefully they're wearing a mask and that protects you. The other thing with the mask we found is improper wearing of them. So your mask must cover your entire face, your nose, and your mouth. Many people, you see that wearing it down like that, or even pulling it down to speak. It needs to be over your entire nose and your mouth. So those are just 2 tips for today from what was observed as the inspectors were out just doing surveillance yesterday. We're here to educate. We're here to help you. We are all trying to make these changes, and we're learning every day. And so thank you again for being our partners in really making sure that we mitigate the spread of COVID-19 and keep people in our community safe. And with that being said, please stay home. Please stay safe, and please stay calm. Thank you.
You've been watching today's update on COVID-19 from County Executive Kathy Dahl-Kemper. In case you just missed it or just joined us, here are some of the highlights. As she was just saying, the surveillance took place over the past couple of days of the usage of masks in the county. The numbers much better during the first surveillance. The one, though, yesterday showing that only 62.3% of people in Zone 1, which is, of course, the city of Erie, and the zone with the highest number of positive COVID-19 cases, only 62.3% of the people were in compliance wearing masks. She said they are working with Serve Erie for Mask Erie to continue to get masks to those people who need them and to communicate maybe people who speak another language and to educate them. The county's working on those education matters. She said too, to remember if you're going through a drive-through, you should have a mask on when you're getting your food, because again, as they said, my mask protects you, your mask protects me. So if you're going through a drive-through, have your mask in your car and put that on when you are getting your food. Melissa Lyons saying that don't travel unless you have to, and again saying that public health practices needs to change, and that for now handshaking, hugs are a thing of the past. At least for now, she remains hopeful, and that our shopping habits will change. She also said something that needs to be said, and that is trust your public health experts who are trying to fight this COVID-19, and that people need to be patient and that people need to be flexible. That was kind of on the heels of talking about businesses reopening possibly next Friday on May 8th if Erie County is in fact moved into the yellow category. The county does not know right now. The business is listed under that, what can open, what can't open, but we are expected to find out when the governor makes that announcement this Friday on May 1st about whether or not our region will move to yellow. County Executive Kathy Dahl-Kemper, though, did say she's encouraged that Erie County will move to yellow, but not 100% sure, but she does want to make sure that those businesses are ready. Now today, as of this afternoon, here are the latest on confirmed cases of coronavirus near us. Right now, we are seeing 84 cases of positive COVID-19 in Erie County, 2 new cases reported today. One of those cases in their 40s, under the age of 5. One living in Zone 1, one living in Zone 4. Crawford County still reporting 19 cases. Warren County remains at 1. There are 31 confirmed cases in Chautauqua County, New York, and 3 deaths, and 110 confirmed cases in Ashtabula County, Ohio, with 11 deaths there. Pennsylvania Department of Health releasing the latest numbers as well. More than 43,000 positive cases of COVID-19 reported. There have now been 1,716 deaths reported, and more than 165,000 people have tested negative. The best advice, again, stay calm, stay safe, stay home, wash your hands often, remember to practice social distancing, and always wear your mask when you come within reach of anybody else, and if you're going out for essential business. Jet 24 carries a live digital exclusive coronavirus newscast daily at 11:30 a.m., 3 p.m., and 9 p.m. on our website, yourerie.com. We, of course, will have a complete wrap-up tonight on Jet 24 Action News beginning at 5 p.m., and we are live every night at 7 p.m. on Facebook for a wrap-up of the day's events involving COVID-19. Thank you so much for joining us, and have a good afternoon.
This has been a Jet 24 Fox 66 special report. For ongoing developments, log on to yourerie.com. We now return you to your regularly scheduled programming.